Hello, I'm Kira.
I'm Megan.
And I'm Lauren.
We are presenting a case study that correlates with the musculoskeletal system. The musculoskeletal system consists of muscles, bones, ligaments, tendons, and joints.
A 17-year-old female injured herself in a competitive basketball game. During the game, the female went up for a jump and landed wrong, twisting her right foot invertedly. She described her foot as being flaccid and having hypoesthesia in her metatarsals. The coaches thought she had just sprained her foot or ankle because of her not being able to walk on it. After the game, she was taken to the emergency room where she received an x-ray. The results of the x-ray were inconclusive for injuries, but the entire right foot showed signs of edema and the top of the foot showed signs of a contusion. Later, she got an MRI to get a better picture of the injuries. The MRI showed a Lisfranc fracture and a torn Lisfranc ligament.
In order for it to heal properly, she had to schedule a surgery with a podiatrist. Without getting the necessary surgery, it would be very hard to recover from a fracture like this. Less mobility, constant or chronic nerve pain, and balance issues are common complications from this fracture and torn ligament. Before surgery, she was given general anesthesia by an anesthesiologist. During the surgery, 2 K-wire pins were put in her right foot to stabilize the bone while it tried to heal. Post-op procedures were to take anti-inflammatory and oxycodone medication.
After a week, she was able to walk on crutches while wearing a boot cast. 3 months later, she had a second surgery to remove the K-wire pins to let the bone further heal on its own. After the second surgery, she wore her boot for 6 more months and was on crutches for another month. Once the boot was off, she had to go to physical therapy to reduce the edema and osteoarthritis. This would help strengthen the foot ligaments and muscles and improve her atrophy. After 8 months post-injury, she was able to play basketball again with only mild fibromyalgia in her foot. This case study is a good representation of the musculoskeletal system because it gives examples of each part of the systems: muscles, bones, ligaments, tendons, and joints.
This case study also gives insight on some of the conditions, diseases, and disorders that correlate with the musculoskeletal system as well, and how they are treated.
Thanks for watching our case study.